This is Frank Brown Jr., your medical correspondent on station WVGB-FM in Beaufort, South Carolina. Your health is important to us. We are not practicing medicine, but sharing valuable information to help you. Please listen to this following health insight and learn.
This is Dr. Ralph Purcell with a medical moment for you. Today, although I won't be diagnosing or treating, I will be providing you information to help you understand your health. With the COVID pandemic continuing to disrupt our work lives, many of us are sheltering in place and working on our computers at home. We're also starting to enjoy the warmer weather with fishing, bike riding, or completing those home repair projects that we started in the fall. All of these activities can nevertheless lead to a medical condition called Carpal Tunnel Syndrome. This is an irritation or pinching of the median nerve of the wrist, which can lead to numbness or tingling in the fingers. It can lead to weakness or loss of endurance, and sometimes it can cause your fingers to be clumsy, causing you to have trouble buttoning buttons, closing jewelry clasps, or even picking change up from a tabletop. Often, people wake up with fingers being numb, and they flick their wrists to try and wake up their hands. Most importantly, this is a condition that usually worsens without treatment and can become irreversible. This needs to be avoided. The median nerve sits in a tunnel with the tendons that bend your fingers, and sometimes those tendons become inflamed and the nerve gets squeezed or pinched. The more they're squeezing, the more there is nerve damage. In addition to repetitive or prolonged use of the hands causing this problem, there are medical conditions which can increase one's risk of getting this problem. These include pregnancy, diabetes, or even low thyroid. Being overweight is another factor. Thankfully, this is an easily diagnosed condition in the medical office. Sometimes we order a nerve test to tell us how severe the problem is, and most importantly, the earlier the condition is diagnosed, the earlier treatment can begin, and the more likely surgery to release the nerve can be avoided. Treatment options begin very simply with changing one's activities, avoiding repetitive or prolonged wrist bending, using a wrist brace at night to keep the wrist straight and to reduce the pressure on the nerve. Sometimes anti-inflammatory medicine is needed. With moderate or persistent carpal tunnel syndrome, sometimes therapy is needed or even a cortisone injection. If conservative care fails, then surgery can be performed through tiny incisions the width of a pencil. And thankfully, surgery is normally successful. But remember that not all numbness and tingling in the fingers is carpal tunnel syndrome. Beware that other conditions can masquerade as carpal tunnel syndrome, such as a pinched nerve in the neck from a slipped or herniated disc or a bone spur. Other times, the nerve can be pinched in the forearm and not the wrist. And yet other times, diabetes or toxic exposure to chemicals can deaden a nerve or cause numbness and tingling. So if you're experiencing these complaints, see your healthcare provider and have it checked out. Till next time, this is Dr. Purcell asking you to stay safe and be well.